Hi, I'm Dr. Leslie Gray with Dermatology Center of Atlanta, and it is hot and it is July. July is also Hyperpigmentation Awareness Month, so I wanted to spend some time this month talking about hyperpigmentation and the different types, treatments available, because it is really probably one of the more common concerns that people will come into the office with when they're trying to improve the look of their skin. So the three most common types of hyperpigmentation I think that we see in the office are sunspots, which would be like your freckles, or what people call age spots or liver spots, post-inflammatory hyperpigmentation, which is a big fancy way for basically saying your skin was ticked off and now it's dark. So that can happen, for instance, with acne. Maybe you have an acne spot, a cyst, it's red, then the red turns to brown and you're waiting for your brown to go away. Or maybe you have a scar, a scratch, surgery, and the spot again was red and then it turns brown. So those can be frustrating for people as well, and it's certainly its own little subtype of hyperpigmentation. And lastly, and probably most importantly, and probably the most common thing we see, is melasma. Melasma is also known as the mask of pregnancy, but you don't have to ever have had a baby to get it. Melasma is a patchy, splotchy type of pigmentation that is more commonly seen in women, but men can see it too. And we see it typically on the cheeks, the upper lip, the chin, sometimes the forehead. And it's kind of in a very distinctive pattern, and the pattern might fade and get darker, but it always stays the same shape. The triggers for it can be hormonal, so that's why we call it the mask of pregnancy, because pregnancy can sometimes bring it on, but so can birth control pills, and sometimes nothing, it just happens. So those are probably the three most common things that people will come in, again, for a concern with pigmentation. So what to do about this? There are several different approaches. You can start with just skincare, and I think if you are struggling at all with any type of pigmentation, sunscreen is the base of all this. We preach sunscreen anyway in this office, but especially if you suffer with hyperpigmentation, please wear your sunscreen daily. Typically we say 30 to 50. I personally prefer, if you have hyperpigmentation, to stay more in the 40 to 50 range. It's a daily thing. You need to reapply if you're going to be outside. There's lots of good options, I think, for sunscreens, but the consistency is important. When you are treating pigment, your day in, day out skincare is very important. Usually a skin regimen for someone with hyperpigmentation consists of the sunscreen, of course, a skin lightening agent, and that can be prescription strength like hydroquinones. We offer a couple different strengths here in the office. Sometimes it's non-prescription. Actually, SkinMedica makes a great one called Even Correct that sometimes we'll use either in conjunction with the prescription or as a standalone, and they actually have some pads and some spot treatment as well. And an antioxidant, like Regimen makes a nice antioxidant. SkinCeuticals makes an excellent one too. So there's different types that you can do, but being very consistent and being very patient and very persistent with it is really what kind of helps move the needle with pigmentation in the long run. And really, if you're treating just with day in, day out skincare, you can make some improvements, but it's just, pigmentation is frustrating because it just never gets to be perfect. I always say it's usually something you can control versus cure. The exception being usually post-inflammatory hyperpigmentation. Again, if you've had some type of incidental temporary injury to your skin and it's brown, usually that will go away unless you haven't been wearing sunscreen and you had really inflamed skin and you got a lot of sun. You can really drive that pigment deep, and sometimes that can be a really persistent type of hyperpigmentation. I've seen that happen. So you really, if you do have some kind of injury to your skin, make sure you're protecting. Covering it is even better if you can. Okay, so let's talk quickly about maybe some procedures. So let's say you're doing your skincare and you want to do a little bit more. What you treat and how we treat, a lot of it's dependent on your skin type, because lighter skin types, if you have lighter, fairer skin where you burn easily, you have trouble tanning, you have lighter eyes, you have lighter hair, that lighter skin type you can be actually more aggressive with. If you have more olive skin type, if you have darker hair, darker eyes, a dark complexion, that type of pigmentation, or that if you have pigmentation in that skin type, you do have to be much more cautious. So we might pick lighter treatments in that case on purpose, where maybe it takes more rounds and we're going to go low and slow with your skin. So what can you do? So if you have the post-inflammatory hyperpigmentation, sometimes again, the day in, day out skincare might just be enough for you, and the really strict sunscreens. If you wanted to do more, sometimes lighter peels will do it. Sometimes even Vivace, which is a radio frequency type of microneedling, sometimes that can help too. If you're the sunspot kind of gal, maybe you have, again, these little age spots, sunspots, freckles that you just want to decrease. BBL is a great choice for that. Peels, again, lighter, or maybe you're getting more aggressive at this point. There's something called a halo laser, which is wonderful for taking away some of the pigment and also improving texture. And again, Vivace at times as well. And then melasma. Melasma is the trickiest one to treat. And again, you're looking for control versus cure. We want improvements, slow and steady. So again, depending on your skin type will kind of guide how aggressive we can be. BBL may work. That can be tricky. Halo, even though it's generally a more aggressive procedure, sometimes it's a safer procedure in certain skin types. For melasma, peels, sometimes going low and slow with peels, or again, depending on your skin type, we can get a little bit more aggressive. And again, plus minus Vivace. So those are kind of your options with hyperpigmentation. I think, you just have to have patience. I think it can be confusing too, not knowing which type of pigmentation do I have. I see the blotches on my skin, I'm not sure. That's when we really encourage you to come in. You can talk to the ladies certainly at our Advanced Skincare Center. We also offer cosmetic consultations, and you can kind of dive a little bit more in depth to see what would be right for you. So this month, in honor of Hyperpigmentation Awareness Month, we have a little special. So we are offering a little brightening bundle, which has a really cute travel size of our Even and Correct, a wonderful SkinCeuticals CE Ferulic, yes, great antioxidant, and an AHA-based SkinMedica cleanser. This little cute bundle is yours with 1, 2, or 3, oops, of any of these SkinMedica lines from the Even and Correct. So take advantage of that. If you're one who struggles with hyperpigmentation, it's a great way to start. Also, we're offering a skin pen, it's a little special here. You get a complimentary C correcting complex with your purchase of either a package of microneedling or even a single treatment. It's $113 value. It's good with your microneedling session with Alini, our fabulous esthetician. She's 12 years experience and you will love her, so I encourage you to do that. Microneedling is great also to do in the summer because it's not one of some of the procedures you have to be super sun cautious. You always need to be sun cautious, quite frankly, if you're doing something in the summer, but this one's a little bit easier to do. So that might be a good choice for you if you're looking to improve, especially the texture of your skin this summer. And then lastly, I have extra special, a fun thing. We're going to have one of our famous event days towards the end of July. We are still working out all the details. We want to be really clear when we tell you about it, so stay tuned. I will tell you, you will have big savings, we always have prizes, and we always have a lot of fun. So that's going to happen towards the end of July. We will be sending you more information, so be on the lookout. All right, well, thanks so much. I hope you found this helpful, and I hope to see you in the office soon. Enjoy the summer, stay cool, and safe travels if you're traveling. Bye.